Welcome to the Explainer. So, what if I told you that a medical system developed over 2,000 years ago is currently being mapped, tested, and validated by today's most advanced biomedical science? It's pretty wild to think about. Today we're taking a fascinating journey into traditional Chinese medicine, and we're going to explore how ancient concepts of balancing the body are actually finding surprising measurable parallels in modern neuroscience, immunology, and systems biology.
It's kind of the ultimate question, isn't it? I mean, can these historical, time-tested practices really hold their own against the intense scrutiny of today's evidence-based biomedical world? For a long time, conventional medicine looked at these non-pharmacological interventions and thought they were, frankly, just too difficult to evaluate. But advances in functional neuroimaging, molecular biology, and computational medicine have totally flipped the script on that, giving us the hard data we need to back up this ancient wisdom.
Okay, let's dive right into this. Today we're covering the philosophy of TCM, decoding acupuncture, movement as medicine, Chinese herbal medicine, and finally, the integrated future of healthcare.
Section 1. The philosophy of TCM, a paradigm shift.
Historically, conventional Western medicine has been absolutely brilliant at focusing on isolated organ pathology. Identifying a specific downstream defect in a single organ and hitting it with a targeted treatment. Classical Chinese medicine, though, it conceptualizes health entirely differently. It's looking at functional balance and dynamic physiological relationships. It's a very upstream approach. It recognizes that chronic conditions don't just stay neatly within the boundaries of isolated organs. They really require a comprehensive, interconnected approach.
Traditional Chinese medicine conceptually maps out this functional balance of interconnected organ systems and vital energy flow, which you've probably heard referred to as qi. And look, while terms like qi or meridians were formulated way before we had any understanding of anatomy or microscopic physiology, modern systems biology is actually reaching remarkably similar conclusions today. Health is an emergent property. It comes from the coordinated communication among all your biological networks: nervous, endocrine, immune, cardiovascular. TCM has basically been intuitively treating this entire network for millennia.
And to treat that massive, complex network, TCM relies on a really diverse tool set. We're talking herbal medicine, acupuncture, moxibustion, mind-body practices like Tai Chi and Qigong, dietary therapy, and manual techniques. It is literally never just one magic pill. It's a multimodal approach that's designed to influence multiple physiological systems all at once, just to restore that functional balance.
Section 2. Decoding acupuncture, the science of needles. Acupuncture is definitely the most extensively studied TCM intervention in modern research. When a needle is inserted, it kicks off this wild chain reaction. First, the needle stimulates peripheral sensory nerve fibers. Those signals then travel incredibly fast up the spinal cord. Finally, the input hits higher centers in the brain, triggering the modulation of central pain processing. And this actually includes the release of endogenous opioids, so your body's natural painkillers, like endorphins and enkephalins, and it even influences neurotransmitters like serotonin.
The absolutely crucial point here is that persistent pain isn't just about a tissue injury. It's a disorder of altered nervous system processing. And this brings us to neuroplasticity. Experimental studies are suggesting that acupuncture actually influences cortical reorganization and descending inhibitory pathways. Basically, it helps rewire those maladaptive pain networks over time. This gives us a massive scientific basis for its use in chronic pain and for selected clinical indications that are now recognized by national guidelines in quite a few countries. Though, to be fair, the evidence is definitely stronger for some conditions than others. And we aren't just guessing about this anymore. Functional neuroimaging, like fMRI scans, proves that acupuncture physically alters activation in specific brain regions involved in pain processing, emotion, and autonomic control. It literally provides mechanistic plausibility. This shows definitively that we're looking at real central pain modulation here, not just some simple placebo effect.
Section 3. Movement as medicine, Tai Chi and Qigong.
Tai Chi and Qigong combine gentle movement, postural alignment, and mindfulness with breathing regulation. But why does this matter? Well, it really comes down to autonomic nervous system regulation. Chronic disease is so frequently driven by sympathetic overdrive, way too much fight or flight. The slow, rhythmic movements and diaphragmatic breathing in these practices have been scientifically shown to enhance vagal activity. They boost your parasympathetic rest and digest system, which improves heart rate variability and deeply reduces physiological stress.
Because these practices are influencing the body on a systems level, the clinical benefits are incredibly broad. The evidence strongly supports their use for improving balance and fall prevention, enhancing functional mobility, lowering blood pressure, and bringing real improvements to mental well-being. But here's the big takeaway. Because these routines are so gentle and low impact, they are perfectly suited for frail, elderly populations or folks with chronic pain who just can't tolerate high-intensity conventional exercise. It gives them back their confidence and independence.
Section 4. The complexity of Chinese herbal medicine.
Now, when we objectively look at the reality of herbal medicine today, we see this immense potential right alongside some pretty significant clinical challenges. On one hand, it is a highly active area of research. Many of these herbs contain really potent, biologically active constituents that are being investigated for chronic disease management as adjunctive therapies. But on the flip side, unlike standardized pharmaceuticals, herbal formulations can vary wildly. There's a huge, pressing need for strict quality control, standardization, and rigorous clinical trials. Plus, we've got to be hyper-vigilant about the risk of herb-drug interactions because natural compounds can very strongly affect how prescription medications are metabolized in the body.
Section 5. The Integrated Future. Whole Person Care.
So, what does the future of whole person care actually look like? Well, the goal here is absolutely never to replace conventional Western medicine. We need modern medicine for accurate diagnosis, emergency trauma, and targeted pharmacological treatments for sure. But by integrating complementary practices like acupuncture for pain modulation or Tai Chi for autonomic regulation, we build the patient's physiological resilience upstream. We're essentially combining the best of both paradigms to treat the interconnected biological systems of the patient as a complete whole.
Which leads us to this incredibly powerful summary quote from the source material. Health is maintained not by a single organ, but by the harmonious interaction of multiple biological systems that continuously adapt. Integrated healthcare simply seeks to support these natural regulatory systems right alongside modern medical treatments. It's not at all about choosing between ancient wisdom and modern science. It's about realizing that a lot of times they're describing and treating the exact same complex biological networks.
So I'll leave you with this thought. If your health is actually an emergent property of how well your sleep, your movement, and your medical care all communicate with each other, what is one upstream change you can make today to bring your whole system into balance? Thanks so much for joining me on this explainer, and keep exploring.